Okay, so my name is Sydney Reeves, and it's the 18th of December, and I'm doing my surface anatomy presentation. So I'm going to have my notes on my iPad here. Maybe you can see them. So first off, I'm going to show the clavicle, which is going to be like your bone right here, like kind of right before your ribs, and then your median cubital vein, which is going to be your vein kind of like right up in like this middle area. It's really good for like drawing blood. That's a really good spot for that. And then your umbilicus, which is obviously like it's your umbilical cord. And then your patellar ligament is going to be like this ligament kind of right here, right under your patella. And then your medial malleus of the tibia is going to be that like kind of rigid bone right there. So all 5 of those, like your clavicle is going to help you like find your ribs. That's kind of like why I chose that one right there. It's pretty obvious and prominent. And then it's going to be part of your skeletal system. And then your median cubital vein is obviously part of your nervous system. And like I said, it's really good for like venipunctures and drawing blood and everything right there. It's a really good vein on most people. And then your umbilicus is going to be like a remnant of your fetal circulatory system. It's the best spot for a surgery incision because it's the shortest distance from the skin to the abdominal cavity. So like for lap choles, lap appies, it's mostly they like to put in a trocar like right in your umbilicus. And then I chose your medial, which is part of your patellar ligament is the next one. And so I put that, it's going to be obviously muscular, and it's going to be, I chose it to like test for reflexes, like when you're getting your physical kind of stuff, testing your reflexes right there. And then I chose your medial malleus of your tibia because it helps you find your great saphenous vein, and because that runs anterior to the medial malleus, and it's a good spot for insertion of percutaneous central venous catheters if you can't get a hand catheter or something like that. And then obviously the medial malleus is part of the skeletal system. So then, overall, surface anatomy is just important because it helps you understand and identify the anatomy on radiographs, ultrasounds, any type of medical images. Then it helps locate internal structures. So like I said, the umbilicus is going to be the best spot because it's the closest. It's right on your midline, and it's the shortest distance to the abdominal cavity. And then like your ribs, like your floating ribs, for example, would help you find like your kidneys. And then like your clavicle, like I said, is going to be a good spot to help you find like where your ribs start, and then kind of have a baseline from like thoracic, like your thoracic area. Okay, so I think that's all of it. Thanks.